Today I'm working with a patient who has neck pain with radiating pain. So what I'm going to be doing is called a distraction test, and that's going to be testing whether or not it is because of a neural or a nerve compression that causes it to display those symptoms. There's two ways that this test can be conducted. The first one is when the patient is seated, and the second one is going to be while they're in supine. So for hand position, what you're going to be doing is you're going to be using your hand to wrap around the occiput as well as the chin, making sure not to crush the ears so that way they're comfortable. And once you're in this position, what you're going to do is you're going to apply a distraction by pulling a force directly upward, and then from there, bringing them back down. The positive sign for this is if symptoms are relieved. So we want to see if once we apply the distraction that they no longer feel any of the symptoms from when they were sitting normally. And what that means is that it'd be considered positive and allowing the nerve to be compressed, which is what's causing those symptoms. The second position that we can do is the patient lying in supine, and similar as what we did while we were in seated, what you do is you cradle the head under the occiput and then wrapped around the ears right by the chin. Get into that slight flex position, and all you're gonna do is apply a distraction or force toward you this time, and then allow more space to enter into those where the nerve roots enter. And again, a positive sign would be a relief of symptoms, and that would mean that there is some compression that's causing that radiating pain coming down the upper extremity. This test is important because it helps us to determine what category the patient is in, whether it is neck pain with radiating pain. And it's important because of that relief of symptom, it'll help us choose what treatment is available. So we'll most likely be approaching a multimodal approach with manual therapy as well as strengthening of the DNF muscles or the deep neck flexor muscles as well.